So again, welcome. I am Dr. Amanda, and I am the founder of Adkins Enlightenment Lifestyle Medicine, and I'm so glad to be with you this morning. Again, if you are watching live, put in hello. If you are watching the replay, thank you for coming and watching, and put in replay. And of course, share this video with your friends and family. Um, so if you're watching this, chances are you've been diagnosed with prediabetes, diabetes, or high blood pressure, or someone in your family has, or you've been told you've been heading in that direction, or you just know something isn't right, but you're not sure where to start. Well, what I want you to hear today is this. You do not have to do everything at once, but you do need to start, right? We need to start somewhere, okay? That's why I created 3 distinct levels of care. So you can choose a level of support that means that meets you where you are right now. Okay. So I've had, people ask me, Dr. Amanda, I went to your website and I see that you offer different things. And I just want to know, how do I know which one is the best for me? So I'm just going to go through a little bit of practice and philosophy behind my practice. Okay. So my practice is a lifestyle medicine, which means we focus on root cause of chronic disease, not just managing numbers. Okay. So we don't have you just like a number and seeing what your labs are and just treating like that. I really focus on people that have a diagnosis of chronic conditions like prediabetes, which means your hemoglobin A1C, which is one of your blood tests, numbers is above 5.7, or type 2 diabetes, which means your hemoglobin A1C is above 6.5, or if you've had random blood sugars above 200, and these are even without any symptoms, or if you have high blood pressure. And high blood pressure can be, your top number is greater than 130 and your bottom number is greater than 80. And are you been told that, oh, your blood pressure is a little bit high, you need to, focus on that, or, we need to monitor that. Okay. And these chronic conditions aren't just simply bad luck. Okay. They have a strong influence by nutrition, lifestyle, stress, sleep, and different daily habits that we go through. Okay. And this world, unfortunately, is designed for sometimes convenience and not health, which you can have both. And, we have the medical technology and everything like that. And medications definitely can be helpful. I'm not anti-medication. Um, but there's necessity to actually go beyond that, and it should never be the only strategy. Your medication should not be your only strategy. Okay, so my goal is to actually help you to improve your lab numbers, and even though we don't focus purely on the numbers, you start to actually feel better when you see those numbers get better. We want to reduce the progression of the chronic illnesses, because it's not that they just all of a sudden appear and they just stay at that level. They usually can progress. And we want your body to feel better, okay? And we want you to feel better overall. And we want you to be able to build habits that last beyond your appointment times, okay? So different levels of care that we offer here at Adkins Enlightenment Lifestyle Medicine is the first one is my 5-day whole food cleanse. And most people do it a little bit longer than 5 days. And this is for someone that it's kind of like self-study. I actually walk you through it through videos, and you get access to healthy recipes, a handbook. And this is for you if you're feeling stuck, you want to reset, you feel overwhelmed, but you need some type of structure, and you're just not ready for medical care yet, but you want some type of guidance. Okay. So the cleanse is like a whole food focus. It's not about extremes, it's educational. And it's designed to help you to reduce inflammation, cravings, and the food noise that we all can experience. Okay, it's self-paced. You have access to it for 4 weeks, even though it's designed as a 5-day program. So you can move through at your schedule, and it's not about starving, detox teas, or quick fixes. Okay, even though you can use some detox teas in there, but the focus is the whole food. Okay. And it's about actually learning how food affects your body, and really being in tune with how food, when you eat food or have certain foods in your body, how you feel. It's about giving your system a break from ultra processed foods and creating momentum to keep going. Okay. for many people, this is the entry point. This is the first step towards clarity and confidence. Okay. And I've had, like lots of people go through this 5-day cleanse, and some have done it several times. And again, it's just for people that feel like they need that reset, and they feel like they're amazed of how they feel in just 5 days. And a lot of people, like, even though it is a plant-based cleanse, that people like, even though they're not vegan, they're not vegetarian, that they were amazed on how good they felt. They did not feel hungry. They had better clarity, less mental fog, less joint aches. They slept better. They actually lost weight in those 5 days, right? And it was just, again, a step towards confidence boosting in the right direction for them. Okay. So that's the first level you can do. And that's the first level on the website that you'll see. It's under EHW, which stands for Enlightenment, Health, and Wealth, a cleanse. So you can look for that. The next step would be medical consults for prediabetes, diabetes, and hypertension. And this is for those that are looking for medical expertise and not just information. And I really focus on these three areas because I just feel like we can make the biggest impact, because there's so many people affected by these illnesses that they sometimes get pushed by the wayside because it's not necessarily a heart attack or a stroke, but these are things that can lead to that. And so, and it really affects people of color. And, women are usually have different symptoms, and it's usually often overlooked for them. So I really want to focus on these three illnesses if you've been diagnosed or feel like you are close to being diagnosed with them. Currently, I only see patients for these medical consults in 10 states, and this is via secure video. The 10 states would include Indiana, Tennessee, California, Colorado, Texas, Florida, New York, South Carolina, what am I missing? Missouri, and Alabama. So that is as of this video as of now. But you could always check out the website to see if I add any more states. And if you are a person that is outside of those states, we still have something for you. So hold on for listen for that. Okay. So again, for level 2 with the medical consults, those 10 states, the consults are ideally for people that's been recently diagnosed. Their numbers are creeping up. You're on medication and you want to understand your options. You want a lifestyle-based medical guidance from a physician, and not to replace your primary care physician, because you would still see them. And we would, from our office, our virtual office, send any recommendations to your primary care doctor in those 10 states. I can also manage your medications. So we would focus on that. We can review your labs, your medical history during the visit, really understand what's driving the underlying condition, discuss evidence-based lifestyle strategies, and create a clear, realistic plan for you. And then, of course, the visits are not rushed. It's a very thoughtful, patient-centered medical approach. For some, 1 or 2 consults provide exactly what they need. For others, this becomes a bridge to a deeper coaching. Okay. And again, this is in the 10 states, and specifically for people that have pre-diabetes, diabetes, or high blood pressure, or a family history of those things, and they want to try to prevent them. That could be a good aspect also. The next level would be for lifestyle medicine coaching, and this gives you the highest level of support. And this is where really the deepest transformation happens, because it's usually over a longer time. And lifestyle medicine coaching is for people who say, I know what to do, but I'm struggling to stay consistent. I want accountability. I'm tired of starting over and over again. I want long-term change and not just temporary results. That is huge, because a lot of people, they do these programs and they just like get the results, and then they, slide back down, and then they're back to where they started. Okay. So inside the coaching, we work together to improve your blood sugar, your blood pressure, and your metabolic health. We address habits, routines, and mindset, because that's very big. We navigate real life, like travel, holidays, stress, busy schedules, life as a parent, life as a high stress job, whatever it may be. We actually build confidence and helps with sustainability. And this is where education meets application. Okay. You're just not told what to do. You're supported in what to do as well. Okay. So you need to pick which level is right for you. So here's what I want you to know. There's no wrong starting point. Okay. So some people that may really, really benefit from the coaching, like, I don't know, and they start with the cleanse, and that's okay. And some people like, I already have the diagnosis. I've tried things before. I really want to go straight to the medical consults. And I live in one of those 10 states. And, you can go right there and that's perfectly fine. You don't have to move through the 3 levels. You can pick which level is right for you. And then we can, go back and forth between the three, depending on, how you progress. And then some people are ready for coaching right now. Okay. And that's the people that's done like the cleanses and, different consults and they're still feeling stuck. Okay. So what matters most is that you choose something instead of just staying stuck. So just choose an option and we'll definitely help you through it. And at any level, you will get results. You will actually feel better. So don't feel like you have ever made the wrong decision. Okay. So why now matters. You don't want to wait because you're like, you continue to wait. Imagine a year from now, your blood tests are better, like you have better energy, you understand your body and the way that your body reacts to food, like a sleep or better sleep, and you're no longer afraid of what your next doctor's visit will be. Because I've had people that come say, I canceled my last appointment because I didn't want you to tell me what was going on. We don't ever want you to feel that way. Okay. So chronic disease itself does not reverse itself, but you can improve when it is addressed at the root cause. And your health is one of the few investments that pays dividends for decades. Okay. So you want that return on investment, invest in your health. So the next step would be is to come into my website because this is a 100% virtual practice. And as we can help you from the comfort of your own home. And you can go to www.dramandamd.com/services and review the 3 levels, choose the one that fits for you and begin today. Okay. So don't hesitate, go right in. Also, I forgot to mention that even though the level 1 is a self-paced program, again, you will have access to me. And maybe I did mention this, that you will be able to email me if you have directly, and it'll be coming, the answer will be coming from me. And if you have questions along the way, that can really help you as you go through the cleanse also. So don't feel like you don't have any support at all at that level. Okay. So your body was designed to heal when we give it the right support. And it's always an honor to walk with you through your health and wellness journey. Okay. So I hope this actually clarifies some things for people because they were always wondering what was going on. So that is the levels that you can work with me, Dr. Amanda at Adkins Enlightenment Lifestyle Medicine. And I look forward to working with you all soon. Don't forget to share the video and tell someone who has those diagnoses, pre-diabetes, diabetes, high blood pressure, or family history of those, and really looking to bring their health back under their control. Bless the health to y'all, and I look forward to seeing you next time.